A patient once sat across from me and said, "Doctor, my report says lymphoma. Is that same as leukemia?" It's one of the most common questions I hear, and honestly, I understand why. If you search the internet for blood cancer, you will quickly encounter two words: leukemia, lymphoma. Many people assume they are different names for the same disease. They are not. In fact, they begin in different places, behave differently, and are often treated differently. Today, I am going to explain the difference in a way that you will remember long after the video ends. I am Dr. Ganesh Jaishetwar, Senior Consult Hematologist and Bone Marrow Transplant Specialist. Let's start with leukemia. Imagine your bone marrow as a large manufacturing plant. Inside your bones is a remarkable factory responsible for producing blood cells every second of the day. Red blood cells, white blood cells, platelets. Everything begins there. Leukemia develops when abnormal blood forming cells start multiplying inside that factory. The production line becomes disrupted. Healthy cells are crowded out, abnormal cells begin taking over. Because the disease starts in the bone marrow and affects blood production, leukemia often shows up through symptoms such as severe fatigue, frequent infections, fever, easy bruising, and bleeding, low blood counts. In simple terms, leukemia is primarily a disease of the blood forming system. Now let's talk about lymphoma. To understand lymphoma, imagine a completely different network inside the body. The lymphatic system, that is part of your immune system. It consists of lymph nodes and lymphatic channels located throughout the body, in the neck, under the arms, inside the chest, in the abdomen, and in the groin. These lymph nodes act like security checkpoints. They help monitor and protect the body. Lymphoma develops when certain immune cells called as lymphocytes become abnormal and begin multiplying uncontrollably within the lymphatic system. Instead of starting in the blood factory, lymphoma usually starts in the body's immune network. That's why patients with lymphoma often notice painless swelling in the leg, lump under the arms, persistent enlarged lymph nodes, night sweats, and unexplained weight loss, persistent fever. Now, here is where many people become confused. Can lymphoma affect the bone marrow? Yes. Can leukemia involve the lymph nodes? Absolutely yes. This can be overlapping, but the primary origin of the disease is what distinguishes them. Think of it this way: leukemia starts in the blood making factory, lymphoma starts in the immune system's security network. Different starting points, different biology, and different treatment strategies. And this difference matters enormously because treatment is never based simply on the word blood cancer. Treatment is based on the exact type of blood cancer, its genetics, its behavior, its stage, its molecular profile, and its risk category. Modern hematology has become incredibly precise. Today we have advanced diagnostic tools that help us understand these diseases in the ways that were unimaginable a generation ago. We now use flow cytometry, molecular testing, genetic profiling, advanced imaging, and targeted therapies, immunotherapies, and cellular therapy, and sophisticated transplant strategies when absolutely necessary. This means these two patients may both hear the words blood cancer yet receive completely different treatment plan, and that's exactly how modern medicine should work. Personalized, evidence-based, and tailor to the biology of the disease. The message I want every viewer to take away today is simple. Leukemia and lymphoma are not interchangeable terms. They are different diseases, and understanding the difference helps patient ask better questions and make better treatment decisions. Most importantly, both conditions have seen remarkable advances in treatments over the last decade. Many patients today achieve outcomes that would have been extremely difficult to imagine years ago. So if your loved one has recently been diagnosed with leukemia or lymphoma, don't rely on internet assumptions. Get clarity, understand your diagnosis, know exactly what type of disease you are dealing with, because understanding is the first step towards effective treatment. If this explanation helped you, share it with someone who has recently been diagnosed with a blood disorder or blood cancer. It may help them better understand their journey. Thank you for watching. Stay informed, stay empowered. I will see you in my next video.